Our bone marrow is responsible for the creation of all the blood cells that exist in the bloodstream. White blood cells help fight infection, red blood cells carry oxygen, and platelets help stop bleeding. Myelodysplastic syndromes are conditions that can disrupt these symptoms due to the blood-forming cells in the bone marrow becoming damaged. The resulting damage can lead to diminished numbers of one or more types of these blood cells. Common myelodysplastic syndrome symptoms include chronic tiredness and shortness of breath, or anemia, increased infection susceptibility, and low platelet count. In the case of myelodysplastic syndromes, some of the cells within the bone marrow become damaged and have difficulty creating new blood cells. A number of the blood cells created by the damaged bone marrow cells end up as defective.
If you look inside the bone marrow, you'll actually find too many cells are being made. The bone marrow is packed with cells, and there's a paradox to this. There are too many cells in the bone marrow, but too few cells in the bloodstream. The reason for this is that the too many cells in the bone marrow are all dysplastic. They're bad growing cells. They're not effective at making the components of the bloodstream that we need.
In about 1/3 of patients, myelodysplastic syndromes can progress to become a rapidly proliferating type of bone marrow cancer, known as acute myeloid leukemia. Since most patients do not get leukemia, myelodysplastic syndrome was previously classified as a disease with a potential for malignancy.
Some types of myelodysplastic syndrome are not very serious. One of my patients once referred to it as myelodysplasia syndrome instead of myelodysplastic syndrome. The reason is that in that patient's case, he had blood counts that were low, but not so low that he needed transfusions, and he lived for years with his myelodysplastic syndrome. In situations like that, you wonder whether myelodysplastic syndrome should be considered a cancer or a pre-leukemia. Then there are other types of myelodysplastic syndrome that are very serious. People have very low blood counts. They need blood or platelet transfusions as frequently as every week or many times during a week, and they get very bad infections. For those subtypes of myelodysplastic syndrome, people's survival actually isn't very long, and it can transform to leukemia. So to summarize all of this, myelodysplastic syndrome can be serious. We do think of it as a cancer. People in earlier stages of myelodysplastic syndrome can live for years. Those in later stages of myelodysplastic syndrome don't have a very long survival, and it's in those later stages of myelodysplastic syndrome that we truly consider this to be a pre-leukemia, because those people have a much higher rate of transforming to leukemia.
Are you seeking the greatest value for your medical expenses? In need of the largest set of treatment options? Empowered Patient can link you to a network of expert healthcare providers who can bring you the best quality medical care at costs that are affordable. Healthcare solutions that preserve your financial well-being in your pursuit of a happier, healthier you. Give us a call today at 888-333-1027.